it can be good to time it. And especially during rest, an optimal breathing pattern or rate would be 6 breaths per minute. So you could breathe in 2, 3, 4, out 3, 4, 5, 6, in 2, 3, 4, out 3, 4, 5, 6, in 2, 3, 4, out 3, 4, 5, 6, in 2, 3, 4, out 3, 4, 5, 6, in 2, 3, 4, out 3, 4, 5, 6, in 2, 3, 4, out 3, 4, 5, 6, in 2, 3, 4, out 3, 4, 5, 6. And if you continue like that, so you are breathing in for a count of 4 seconds. You are breathing out for a count of 6 seconds. But during rest, you should not hear your breathing. Don't breathe harder than what you feel you need to breathe. The harder you breathe, it can contribute to bronchoconstriction. And we often see it with people with asthma. They feel that their airways are getting tight. They feel that they are not getting enough air. They start to breathe harder in an effort to get rid of the feeling of suffocation. But this causes their airways to cool and dry out, and this feeds back into airway narrowing. So anytime that you have symptoms, whether it's coughing, whether it's wheezing, whether it's breathlessness, a good way to help control your breathing is to do small breath holds. And this goes as follows. Take a normal breath in through your nose, a normal breath out through your nose, pinch your nose and hold your nose. 5, 4, 3, 2, 1. Let go, but breathe in. And then you breathe normal for 10 seconds. And again, take a normal breath in through your nose, a normal breath out through your nose. You pinch your nose with your fingers. 5, 4, 3, 2, 1. Let go, but breathe in. Breathe normal for 10 seconds. And again, take a normal breath in through your nose, a normal breath out through your nose. Pinch your nose and hold your nose. 5, 4, 3, 2, 1. Let go, but breathe in and breathe normal for 10 seconds. And again, normal breath in, normal breath out. Pinch your nose and hold your nose. 5, 4, 3, 2, 1. Let go, but to breathe in and breathe normal for 10 seconds. It's important that the length of your breath hold time doesn't disrupt your breathing. And the rule of thumb is that the length of your breath hold time shouldn't be any more than your control pause or the measurement of your breath hold time that you measured at the beginning of this webinar. If your breath hold time is 6 seconds, then the length of time that you should hold your breath during this exercise is only 3 seconds. In other words, we want to try and control breathing, but we don't want to hold the breath for too long that it causes a loss of control of breathing. When your breathing is labored, it's very important, don't breathe fast and shallow, because that will only feed back into your symptoms. If you take big, deep breaths, you are blowing off too much carbon dioxide, and this will cause blood vessels to constrict. This will cause what's called a left shift of the oxyhemoglobin dissociation curve. But ultimately, the more air you breathe, the less oxygen gets delivered throughout the body. Don't have the belief that it's good to take more air into your lungs. If you breathe hard, you will feel lightheaded. That's not a sign of increased oxygen delivery to the brain. What has happened there is that the hard breathing has got rid of too much carbon dioxide from the blood through the lungs, and the loss of carbon dioxide reduces blood flow to the brain. So when we did this small little breath hold exercise earlier on, by breathing in through your nose, by breathing out, by pinching your nose for 3 to 5 seconds and then letting go, you are helping to harness nasal nitric oxide in the nasal cavity. Nitric oxide is produced in the nasal cavity. It's produced in the nose, and it's also produced in the paranasal sinuses. But nitric oxide has antiviral effects. It's an antibacterial, it's antimicrobial. It's not produced in the lungs to the same quantity as it is produced in the nose, and it's not produced in the mouth.